Thank you all so much for joining us for today's listening session. We will be covering Reach Out and Read program enhancements. There's a lot of extra things you get by being a part of the Reach Out and Read program beyond just books at a discounted rate. And so we wanted to take some time to just share all those different opportunities that you have just to enhance your education, enhance your program overall, and just really ensure that you are offering the program to its fullest capacity. Today, I am joined by Mindy Etheridge. She's an incredible board member of our program, and she has done the Reach Out and Read program prior to being in the board role. So I'm hoping that she'll help to kind of share a little bit more of like the ins and outs. I have never personally worked in a clinic. While I do know a lot about the program, I don't know as much about the exact facilitation of it. So I'm really hoping that with Mindy, we'll be able to paint a whole picture of the opportunities available. So that's a bit about us. In the chat, if you would be able to take some time to share just your name, how you're affiliated with Reach Out and Read in Illinois, if you are a part of a clinic, if you don't mind sharing which clinic you're a part of, and then what all you're hoping to gain from today's session. Now, this wouldn't be a Reach Out and Read session if we didn't cover the core required training module. To access all of the training modules we're going to be talking about today, once you are signed into your My ROR account, on the top right-hand side, there will be a button that says Training. That's where all of these training modules are housed under. Now, if you haven't completed the core training, it should pop up right at the very, very top once signed in and clicked into that button. It should either say continue or start training if you have not finished it. And this goes for every training that is specific in my ROR. If you have not done them, they should auto-populate at the very, very top of your screen. If you have completed the training and you just want to do like a refresher, or if you want to access your training certificates, that way you can access your CME, you do so underneath. It's a little bit lower on that page under your training history, and this will show for all of the modules that you have completed before. The core training, as always, is a required component of the Reach Out and Read program. It's how we kind of center our facilitation of the program rooted in the models. That way we can ensure that everything is being done with fidelity to the model. Anybody who is in pediatric or family practice as an MD, DO, NP, or PA are required to complete this training. There is 1.5 CME or Mach 2 points available for completing this training course. Everybody else in the staff at your clinic is encouraged to complete this training if they are involved in the Reach Out and Read program, but they are not required to do so. I know getting people to do the training is a little tricky, especially when you are in that site coordinator role. Mindy, did you have any tips or tricks to share about that?
Yeah, I know that it can be, to your point, very tricky. And I didn't personally have residents in my clinic. I know other Reach Out and Read site coordinators that did. So, what they implemented, excuse me, if there's anybody that has that situation, is they would have it part of their onboarding process, their orientation, so to speak, when the residents were just joining the clinic to kind of say, this is one of our requirements, so to speak. As far as getting the, in an individual clinic, most times when you're in a clinic, you have that rapport with those physicians. They're reaching out to you for different other things of help in the clinic. So I would just, send emails and then just follow up personally just to make sure and explain a little bit more in depth of why it's needed to be done.
Absolutely. And then on that note too, especially with residents, this training does transfer as they move from clinic to clinic, regardless of if they stay in state. So once they land in another clinic, if that clinic does do Reach Out and Read, they'll be able to just search their name and should be able to find their training, and it will carry with them. Another thing on that too, it's not yet required, but they will be soon requiring it at the national level to redo and retrain your providers on I think 3 or 7 year basis. That is coming down the pike. Don't have too much insight into when that will be true, but that's something to keep in mind too, especially for those that are like, they have been doing this program since the very beginning, so it might be a little bit trickier to get them to retrain it later. The core training is not the only training that is available through my ROR. There is also, this is after Mindy's time as a coordinator, there is now a site coordinator training. Again, if you have not yet completed it and you have the role required in order to do this, it should auto-populate at the very, very top of your training page. Otherwise, you can again review and view your training certificate underneath your training history too. This one is a little bit more unique than the core training. So the core ROR 101 training, you are required to do it start to finish. You can't jump around between modules, and it is really just like a whole thing. This one is a little bit more piecemeal. So if you are in a site coordinator role and you have a specific need or question about different components of running the Reach Out and Read program from a logistical standpoint, you can jump around. In total, the course should take about 35 minutes to do, but again, you can just jump around. If there's something that's really relevant to you or not as relevant to you, you can kind of pick and choose whatever you want to do for your training. This one is not offer any kind of additional education component, so there's no CME or Mach 2 points available, and it is completely optional. So if you've been a site coordinator role and this is not your first rodeo for the most part, you don't have to do this. But say progress reports are coming up and you have a question specifically about progress reports that you aren't able to get to me for because it's 11 p.m. the night that the progress report is due and you have a question. This is something that you can do to do this. Like I said, it's very piecemeal. You don't have to do it all in one setting. And it does break it down very, very like you will understand by the very, very end how to be a site coordinator in and out. Outside of the training though, Mindy, because I know you didn't do this training because it's very, very new. Do you have any tips for anybody who is in the site coordinator role?
Well, honestly, I think this would be very beneficial. Being very transparent, I haven't done it myself, like you said, but it's 35 minutes. I mean, that's barely any time. And when you're doing the site coordinator training, typically you're kind of individualized. Nobody else in the clinic knows how to do it. So you are, so to speak, kind of on your own, and having this to navigate, I would definitely encourage anybody to do.
Absolutely. And this isn't, so it is great, it is holistic in its approach, but there are some additional things that I wanted to talk about today too that you'll have access to. We'll get to them a little bit later, but there's a lot more like templates and how-to guides and FAQs that also would be helpful for anybody in the site coordinator role. There are additional training opportunities too through my ROR, but they are not through my ROR. So there's another training module called PathRight. If you want to access any of the external courses that are available from PathRight, you can do so through your my ROR portal. So again, through that training portal, or training landing page, when you scroll all the way down to the very, very bottom, there should be a header called external courses, and then it will say visit learning community. Once you click that, it'll pop open PathRight, and it is just the same login for my ROR, so your same email and same unique password. Once you get there, this will be what it looks like. As you can see for me, myself, I have only started one of these trainings, and that was just simply to see what it was like. This is not all of the trainings that are available. This is just the ones that you have started, and it will also show ones that have been completed too. If you want to view all of the training opportunities on the very top left, there is a menu button. You click that, and then you can see either the home, which takes you back to that landing page we're just at, or the full library. The full library should have for everybody 6 courses total that you can take, some of which offer additional CME or Mach 2 credit, some of which are just optional, and even some of which are like for non-ROR folks. So say you find yourself with a new community funding partner or a new community partner in and of itself, that would be a great one to offer them. I don't know exactly how to give it to them outside of having an account, but at least you could have like a way to kind of orient yourself for the conversation you could possibly have with a community partner. The very first one is that community partnership training that I was just talking about. So like I said, there is no additional credits that you can gain from this, and it is not required for anyone. All of these trainings are completely optional to do. It is just if you want to learn more about Reach Out and Read and other things like that. So this one is really designed for home visitors, Head Start teachers, community health workers, anybody who is in that external role that might be collaborating with you, but also doesn't might not know the full extent of the reach out and read model. So they might know, hey, you give books to kids from birth to 5, but they might not know the ins and outs of how you talk about reading with them, how you facilitate sharing books with a child, all of those ins and outs that are unique to the reach out and read program. So like I said, I don't exactly know how to give this training to them because I think it is just linked to your unique Pathright web page. And I haven't seen too much clarity in terms of this, but it is kind of a cool resource, especially as we are encouraging all of our clinics to try and root themselves within their community, and be holistic in their reach out and read approach. Another training opportunity, this one does have some CME opportunity with it. This is taking that core ROR training one step further. So this is really specific to anybody who is facilitating the reach out and read model in the exam room, and it's focusing in on the way in which the caregiver clinician relationship can impact the patient's experience in the exam room and beyond. It's only for half of a credit of CME and Mach 2, and it is completely optional. And then this should auto-populate for anybody in Reach Out and Read. I don't have a clinic role, and I was able to view all 6 of these training opportunities. So again, if you are looking for additional training opportunities, this is a great one to do too. Mindy, do you have anything to add about those two before we move to the other ones?
No, I think it's really cool that they have the community one. It would be interesting to see if we could figure out how to
Yeah,
share that. Because as you were talking, I was like, well, could somebody like somehow like share it? What they could possibly do is set up a time as a site coordinator to maybe do a Zoom call and do a sharing,
absolutely. Yeah.
So
Like
just
use it as
kind
like a
of,
facilitated module instead of like,
yes,
yeah,
yeah,
that's
just
a
to
great
kind of say,
idea.
hey, this would be, take 15 minutes or 20 minutes just to kind of like go through it. Just a
Yeah.
thought.
That's a great idea too, because it also would expand that conversation. Because yes, you would
Hmm.
encourage them to do it on their own, but also it's probably very unique to the way your clinic does it. So you can extrapolate and add a little bit of narrative here and there.
Yeah, absolutely. That way they're not just kind of doing it on their own. Because let's be honest, you can give people resources and they may or may not like go through with looking at them. So setting up a time to be like, hey, this would be very beneficial for you to get a little bit more insight. So the parent one too, I thought was kind of cool. And that might be something like the physicians might want to look into too. Um, just a thought.
Absolutely. I wholeheartedly agree. There are quite a few more. I was really shocked to see how many external courses, because this
This
used to
has
just be
expanded a
2.
lot.
Yeah, it
Yeah.
used to just be 2, and now it's up to 6, and I think that they're
Wow.
still developing more.
Okay.
So this next one is very specific. So Reach Out and Read does have a expanded version of Reach Out and Read, meaning that it is specifically for clinics who are in the NICU setting. So while the NICU setting is a little bit unique, we would like to establish some normalcy for those caregivers and their children. And so this is a way to do that. So Reach Out and Read can be adapted to work in the NICU. Obviously, the core training is specific for birth to age 5, but this specific setting is not the most relevant to have a training that encompasses birth to age 5. So this is an adapted version of that core ROR 101 training specific for clinicians and staff who work in the NICU setting. It's not too many of our clinics that have this opportunity, but it is something that like we are getting some interest from clinics who are in the NICU setting, and then this is what they would do in lieu of doing the core ROR 101 training. You can still do it. This is not limited to just the NICU friends, but if you have anyone that you want to share about the NICU, because this can be adapted for them, this would be a great resource to utilize too. And there is CME with it as well. And then this is one of the ones that I did know about before diving into all of this. So Reach Out and Read used to offer just 2 through Path, right? This being one of them. It's called Reach Out and Read Counts. So it is a great way to introduce early math development through the Reach Out and Read model. So it talks about how you can incorporate math skills into those well child visits while you're already talking about the book. And it does specifically focus on birth to age 5. So it's a great way to look at the holistic model. So maybe they're struggling with like just abstract concepts, because math is an abstract concept and it takes a little bit before it clicks. So the earlier and more that we can reinforce those ideas, this is where this training kind of comes out of. Like the more we can reinforce those ideas early, the better outcomes that there might
Mhm.
be as the child navigates entering school and beyond. And it is just like the regular module where it kind of scales this. When you're talking to a child that is in the 5 month well child visit, it's not going to look the same as if you were talking about this with a child who is at their 5th year well child visit.
Mhm.
And then this is the other one that I did know about beforehand too. So this is a Reach Out and Read developmental disabilities training. We will cover, I think I added this, if not, in my ROR under the resources tab, which I'll dive into in a little bit. There is a handout that outlines a tremendous amount of developmental delays or disabilities that you might be seeing in your clinic setting, and they are patient or they are parent or caregiver forward. So there are handouts that you can print out and give to the parent or caregiver that kind of talks about how to adapt book sharing with that child to still have that moment together, have that moment of shared bonding, but adapt it to the needs of the specific child. This training, however, is specific to the provider or clinician setting. So it is 8 different videos highlighting the way that various providers have incorporated the Reach Out and Read program with children through age 5 through the context of differing developmental or issues or delays or disabilities. So I think dyslexia is one of them, ADHD is one of them, autism is one of them, and then there's a whole plethora of other ones too. And then those are the ones I knew about beforehand, and even those are still pretty new. Mindy, did you have anything to add about those?
Not particularly, but um, I think those are two great ones that I don't remember being able to
Yeah,
access. But thinking about more opportunities for the physicians to have more conversations like regarding the math, this particular one of the developmental disabilities, I mean, I think that's a great tool for them to have those videos, just to be able to have different ways of reading and introducing reading to children that may have developmental disabilities. I think that's amazing.
exactly. And
And I think,
I'm pretty sure that these two are also, I think all of these are the type where like you can do the whole training and then I think you can go back and like, hey, I just had a child who has this specific need. I think it was covered in this training. I want to look a little bit more closely
mhm,
at this specific scenario. So I believe that these ones you can all go back into. I haven't completed one of these trainings in full yet, so I don't know how easy it is to go back and like review specific components, but I want to say it probably is a thing because I mean, these are living trainings. They're real life scenarios. You can't absorb all of it in just the first
right,
setting.
right.
And then, yeah, that is the last of the Pathright training modules. Like you were able to see, some of them did have the CME or Mach 2 points available. The ones that didn't were just the ones for mostly the community orientation. And all of these should be available through your Pathright. If you want to access that, again, just under that training landing page on the very, very bottom under external training opportunities, and then it'll open Pathright. And then these ones, as with the core ROR 101, as with the site coordinator training, they can be stopped and started as many times as you need to. You don't have to just designate an hour or an hour and a half to completing the entire training. If you have that time, great. If not, you can start and stop it as many times as you need to. And then on the note of training, Mindy and I actually did a session about this last year. So we're going to do a brief overview of this. If you do want more information, I'm pretty sure that that session is recorded and on our website. But in Illinois, we did hear time and time again that, yeah, my staff did the training, but they did the training 5 years ago, and we're kind of straying away from the model. Each day has passed since then. And so in Illinois, we were kind of inspired to start doing a customizable staff refresher toolkit for our clinics. And so that's kind of where this idea came from. We developed it in 2024. And it's been kind of a living document ever since then. So the materials that are available on our website for this now are not the same ones that were when we were first developing it. So this training is not meant to replace the core ROR 101 training. It does not offer any CME. It is just something where if you had staff and you had a team meeting and you wanted to talk to staff that were either not already engaged in the Reach Out and Read program or staff who are, but maybe need a little bit more of a refresher, these slides you can customize to whatever needs you have. And then the two materials that you get are with the first button, the how to use the staff refresher. That is a outline document that kind of describes what each slide is meant to do. And then the download the refresher materials, that is the PowerPoint slide deck that you can fully customize. We included blank slides, so if there's a need that isn't in there, but you want to include, you can do that as well. But it does take some of the high level components of the core ROR 101 training and makes it so you can do it in a 15-minute meeting if you have the time available. Um, but in that session we did last year, we did kind of walk through each step pretty in depth. So if you have any questions about that, we're always happy to answer. I know, Mindy, you definitely, this did not exist when you were in the clinic setting, and you were kind of part of the reason that we did develop this material. But how do you foresee this being used?
Well, I think that, like you were saying, there might be like a requirement at some point to do some type of training again. And I think that's very valuable to do that because you can get going into the system and have your own way going of giving the books out and talking about them. And it may just kind of start going away from the actual way it should be done, so to speak. So I think the staff refresher is good, and it keeps people excited about it too. That's part of the momentum you want to, it's just like, oh, we're just not just giving a book. I mean, we're encouraging, reading in these little minds. So,
Yeah.
um, yeah, if that
I
helps.
think that also touches on something that you said earlier too, where like some of this work can feel kind of isolating, specifically in the clinic setting. So the more opportunities you have, either as a clinic coordinator, as a medical champion, or just as a champion in and of itself, the more opportunities you have to like realign your staff as one,
Hmm.
on this shared concept. I think it's just going to do a lot for your clinic morale overall too. It's great to be able to give out books, but it's great to do it in a team way as well.
Right, right, exactly.
And so on the note of our website, so that first thing you can find on our website, this next section you can also find on our website. But for those who don't know, which you made it here, so I'm sure you do know, in 2024, we started doing a virtual learning series. It started with webinars and then it grew to be webinars and listening sessions. And it's just going to keep growing from there, I bet. But all of our sessions that we have hosted, for the most part, with some listening sessions, we didn't record them because it was mostly organic conversation. But for the most part, most of our virtual learning opportunities have been recorded and uploaded to our website. So under our website, under events, there should be a button that says past webinars. If you click that, that should take you directly to this page. The heading for it should say implementation and support webinars, and that is a whole YouTube library of every session that we have recorded. I want to note though that if you have viewed a session that has CME that was offered, that CME is no longer being offered for just viewing the recorded version. Unfortunately, that's just within the guidelines of CME. It is not an LMS course, so it is just a recording, so it is mostly just for your personal benefit. Underneath the implementation and support webinars, this is a little bit more of a if you know, you know kind of situation. But this is a quick video guides section, and this is mostly like promo materials that we have created in the Illinois level that are available to all of our Reach Out and Read clinics. So say you have someone coming in and you want to do like a little feel good video moment about fundraising opportunities or something like that. Those videos are all underneath that quick video guide section. Um, all of our video assets that have been on social media, so all of our reels and stuff like that, are also under this section too, in both a vertical and horizontal format, so you can kind of use them for however you need. Um, let's see. And then another thing on our website, Mindy knows this near and dear to her heart, is the graduation toolkit. I know we've been pushing this since it was created. I mean, but it's a great material. So, Reach Out and Read in Illinois, we embarked on this journey to try and bring a clear end to the Reach Out and Read program because we were hearing time and time again from clinics that the child would get to that fifth year well child visit. They would be so excited to get their book. And you would try to tell them that this is the last book that they're going to get through this program, unless you were a clinic that was really encouraged and took the initiative to do it through 18, which there's a couple that have done that. But they would get to that fifth year well child visit, and then they would not really understand that this was an end. So we wanted to make this as more of a celebratory conclusion with tangible items that were like clear, like this is it. You have done this, but celebrating it because you have done this and you're ready to grow beyond the program. So we created four specific assets, one of which is a activity booklet, which is this one right here. We also created a parent guide and resources packet, a poster, and then a selfie frame. So the parent resource guide, I actually started recommending to providers giving during that fourth year well child exam. Because this parent resource guide really talks about how to consciously select a kindergarten program for your child, how to know if your child's even ready to go into kindergarten and start their schooling formally, and other aspects like that, which at that fifth year well child visit, typically they've already come to those conclusions. So helping to make an informed choice, maybe giving this one out at the fourth year. But all the rest are used at that fifth year. This activity booklet is for the kiddo to do themselves. There's a lot of really guided activities that kind of bring all of the literacy components that they've hopefully gained through the program and just bring them into one. And then at the very end of that, there's a really, really cute certificate that you as a provider can kind of sign and say like, hey, you have graduated from this program. Great job. I can't wait to see what you do in the future. There's a lot of different activities that you can do with these, a lot of different ways you can use them. They're very much meant to be adaptable. We currently do not have any print materials available, but if you did want any of the items, you can download them from our website. In the toolbar, it should say graduation toolkit, and you can click it and view all the assets there. And you have done so much with this, Mindy. Do you have anything that I missed? Because I haven't done too much with it.
No, you've discussed it really good. I think it's just making sure to remind the physicians about this particular part of the program, that when they are turning 5, or it can be tough because I mean, kids could be 5.5 when they're going to kindergarten, depending on where they're at in their school age. But just because it's a birth to 5 program, just making sure at that well visit that this is established. And like you said, might be part of the site coordinator just to kind of remind the physicians, hey, you've got 4-year-olds coming in here, remember to do this. So I
Yeah.
feel like it might be a little bit more on the coordinator just to kind of refresh the physicians, but it's a phenomenal program. Because like Olivia was saying, when the kids are done, they're like, wait, and every kid loves to be celebrated and they love to know that they have accomplished something, even when they're little. So I think it's a phenomenal program that they've got, or I don't even know if it's a program, but this part of the program.
Yeah. Absolutely. And this, like everything else, is just extra beyond the core ROR 101 training. That is the only thing that is essential. Everything we're talking about today is extra. So if you don't have the capacity to do this, that's okay. Your program is still going well. This is mostly if you have the capacity to do more and you're wanting to do more, here are more things you could do if you wanted. There's a lot that you do in clinic. There's a lot of hats that you wear, and we completely understand that. So this is not meant to be like you are required to do all of these extra things. It is just if you want, here are options. And then this one is a little bit more hidden on our website, but I like went too far. This one is a little bit more hidden on our website, but it is still an opportunity that there is available. So back in 2022, we in Illinois collaborated specifically with the Chicago Public Library to make kind of grab and go kits that are aligned with a specific book. And we also tried to like come together and come up with activities to just kind of make book sharing a little less we're sitting down and reading and a little bit more involved in more of an activity for caregivers and their children to do. The pilot program was a way for us to work with the library and the clinic and kind of bring them together. And then out of that, we developed this toolkit, which the toolkit lives on our website. The pilot project does not exist anymore. We are still looking for opportunities to collaborate with the library. However, we don't specifically work with this program in the clinic setting anymore. Though it is specific to the Chicago Public Library, it can be a really great guide for site coordinators that are not in the Chicagoland area to partner with their local libraries. It gives great opportunities for ideas that you could present to a library or things that you can do in your clinic setting to kind of reinforce how to go to the library and things like that. Mostly the goal of this was just to increase the awareness and utilization of the library programming by, again, utilizing that trusted relationship between provider and caregiver or provider and child to just reinforce that, like, shared book sharing does not end here. If you want more books and you don't have the funds or anything to do so, or even if you do have the funds, but you would like more because you can have every book in the world and not have as many as a library does. This was kind of created out of that need. We do try to reinforce a literacy-rich waiting room environment or exam room environment, and this is a great way to do it beyond the exam room setting or beyond the waiting room setting too. Um, and then, yeah, another component of the Reach Out and Read Illinois program is that we try to do site visits with all of our sites on an annual basis. Site visits are scheduled for up to an hour, and it's really just a time to talk one-on-one. What is going on in your clinic? How are things going in your clinic? What are some areas of success? What are some areas that you need more assistance with? Do you see any areas that you could improve your capacity of, et cetera, et cetera? They're not meant to be punitive. They're just mostly to see, are we as staff really working to meet your unique needs? Is there something I could be doing specifically to ensure that you feel supported in your efforts? Because, not to keep bringing this point up, it is a kind of an isolating thing when you're running this program. It's a very abstract thing. You don't work with the program, you just work in your clinic setting. And so offering staff supports through these site visits is kind of critical to just ensure that we are doing what we can to make sure that your needs are being met. Um, Mindy, I got to meet you through a site visit. So,
I was just thinking about
yeah,
that. Yeah.
yeah. How do you view site visits from your perspective?
I do remember being nervous the first time because I was new to the program, but you guys are so amazing and so warm and friendly, and you're just there to kind of help guide, I guess. It's nice for you guys as the Reach Out and Read um, program coordinators to see how it is run in the clinic, but also for the site coordinators to just be able to ask any questions, make sure that things are going good. No, not punitive at all. It's more of a kind of getting to know and building that connection.
Exactly. And that was always my thing too, is like I can tell everybody that I've never met that my email inbox is open. But half the time they're not going to email me because they don't have that rapport built with me. They don't
Right.
have that trust built with me just yet. And so this is a great way to do that too. Again, we try to do this on an annual basis. Whether or not we get with your clinic on an annual basis is up to your clinic's capacity. These are not meant to kind of obstruct your calendar in any way, shape, or form. If you have the ability to do it, we would love to take the time to meet with you. On our website, underneath for clinics, there is a section for site visits and supports. If you click that schedule site visit button, you should be able to fill out a form that just says, hey, I have these 3 dates available from this specific time frame. What do you have available? We used to do in-person visits. Our capacity has since changed as staff has changed. And so now we're mostly offering these on a virtual basis. There can be some instances where we like work with a clinic you really, really want an in-person visit, and we're able to adapt to your clinic's needs as well. And then this is the final component. So in my ROR, pivoting back to that, once you're assigned into your portal, on the very, very top above where it says training, there's a section called Resource Library. This is an underutilized component of my ROR, and I do understand why it is underutilized. It is organized in a way that makes sense to one person, but not to many. And so I wanted to take some time to just kind of talk about what opportunities are available. When you, as a clinic coordinator, are signed in, you should see two options. You should see suggested resources for providers and their patients, or suggested resources for site support staff. Only those that are in an on-site, off-site, or managerial role in my ROR will have access to this second one. Most everyone will have access to this first one. So the resources you see will depend on what role you are categorized in under my ROR. The library is extensive. There are things from pre-pandemic that talk about how to talk about COVID through books. There are things that are very unique to a specific geography. Wisconsin has a ton of resources in there. Anything in there you are welcome to use. There's nothing that you are not allowed to use. If you can find it, you can use it. And there are so many different opportunities in here. Again, it is organized in a way that makes sense to someone. I don't know who. And it is a little bit tricky. For the most part, if you have a need and they have a search bar, it's not Google, so it doesn't know what you mean all the time whenever you search something. If you don't use the specific keywords, it might not pop up. But all of the items for the most part are organized by category tags. If you can't find something and you think that it should exist, I'm always happy to do my work to see if I can track it down, or if it doesn't exist, I can help work with you to try and create that resource. Through the resource library, you have access to book lists that are specific to different holidays or cultural celebrations. If it's progress reporting time, you're looking for a walkthrough guide or video tutorial, that exists in here. Any of the network calls from Reach Out and Read National, which are not specific to Reach Out and Read staff, they are really just learning opportunities with an external person. So, for example, we have had talks on screen time. We have had talks on how to work with the EMR because Epic is trying to launch an EMR service for tracking books. There are also my ROR user guides, such as how to add and remove contacts, how to send training requirements, all of those things. If you have a social media need and you're in need of some stock images, there are stock images in there from the different age ranges specific to Reach Out and Read. So it's kids, it's caregivers, it's books, it's providers, it's all of those things. There are a lot of one pagers, so if you have a parent and you want to give them a specific one pager talking about reading or anything like that, there are a lot of one pagers available. There's also book vendor guides. So say you have an FAQ about all about books, Barefoot Books or Scholastic, those guides exist in there. And there are also even some digital assets for bookmarks and posters, which you can print. There are a lot more. I didn't cover all of them. The disability caregiver guide is also in there too, and they offer that in so many different languages. But that one is available in there too. It just doesn't fall under a nice tag like the rest of these do. But if you are looking for that one, if you just search disability caregiver guide, it should pop up. And then this is also a new thing. They rolled it out about late last year. So this new opportunity is the Book Explorer tool. So when you are signed in the top right, that's where most of these things are, under books, you'll be able to click that and view the Book Explorer tool. It is a database that the books team from ROR National has created of every book that you are able to order through the Reach Out and Read program. It doesn't matter what vendor, if it's from any of our vendors, it is in there. They do have a tutorial video and an FAQ under that tab as well too, but I will show you exactly what it looks like. So when you are signed into this, you are able to find books based on various different types. So say you have a specific need that you're trying to meet with your books that you're ordering, but you're not really sure where to start. Say you have that you want to order some books for the social emotional theme. If you are looking for that, you can search all of the books that are tagged social emotional on there, and you're able to find all of them and see the different vendors opportunities too. So when you are signed in and you click on a book, you should be able to see the vendor it's from, if it's a picture book, board book, or hardback picture book, the languages that it's able to be ordered in, what ages it should be used for, the themes that it covers, any additional topics and keywords, and then it might even have the book's team favorite tag on it too. It's a really, really great tool if you are looking to fit a specific need. Otherwise, if you have a vendor that you know and trust and you use mostly, you are always just welcome to use that too. This is just an extra thing if you're looking for like a specific type of book. But that is a new tool as well. That's a lot on the My ROR library. Mindy, do you have any, have you ever used the My ROR resource library?
I don't remember doing that. No.
It's like kind of hard to use. It's not very user friendly at first. And like I said, the organization in there is just, it's interesting. Um, but yeah, that's where all of like these additional things from Reach Out and Read National are. They also even have like user guides or user manuals for being a site coordinator or a medical champion too, that outlines like common roles and responsibilities that those roles have. Um, but that is all we've got for today. Mindy, did you have anything to add before we pivot to upcoming events?
No, I think you've covered a lot.
Thanks. So we do have an upcoming webinar on July 22nd. It is a collaboration with the ICAP led program. It is an hour. It's from 12 to 1 on July 22nd. And it's really covering the effects of lead poisoning on early development. And then tips for mitigating that exposure and the effects of it after exposure has occurred. And then how to kind of incorporate Reach Out and Read as a tool to kind of navigate that conversation. This is just the first of our next upcoming virtual learning series. If you are ever curious about what's going on either at Reach Out and Read Illinois' level or ICAP's level, I always encourage you to visit those two websites. We are always keeping a running list of all of the upcoming events on those two different pages. And then ICAP's annual education conference will be occurring in November of this year, and registration should be opening in mid to late July. But that is all we've got for you today. Thank you all so much for joining us. And thank you so much, Mindy, for helping kind of facilitate this and giving that perspective that I just don't personally have. I
Oh, you're
appreciate
absolutely
all of
welcome.
you. Yeah, thank you. I appreciate all of you. I hope you all have a great rest of your day, and we will talk soon.